Mình tin nên chán chẳng hết. Cái bạn chín mình qua đi ăn mê tên cái nên tao bàn về.
Anh cả là đến cho gan toàn chú. Ở chỉ do bị chết để doài.
Mình tiếng nữa. Anh ấy lính á. Chỉ yêu cháu cuốn, anh ấy vừa nữa. Vừa chơi nó cuốn. Vừa biết anh ấy bố.
Yeah, what is very important to know is that TB is curable.
Although TB is responsible for the deaths of many people every year, TB is a treatable disease. In Nyamlel and Gurdim Hospital, there is an ongoing TB health program. This program is implemented by Arcangelo Ali Association through the support of UNDP, the government of South Sudan, the Global Fund, and World Health Organization. Every morning, many patients come to the hospital with various signs and symptoms. They are first given a session on general health education, where they are told about the signs and symptoms of TB and how they can protect themselves from being infected.
The person that we can say is having TB is the person who has been coughing for more than 2 weeks or 3 weeks at the same time. And also that person may be having weakness of the body, sweat at night even when it is cool, body weakness, loss of weight, and loss of appetite at the same time.
Patients who suspect that they may have TB are then screened one-on-one by a clinical officer.
The patient presenting with the cough, and this cough is for 1 month at home there. And she did not go to the clinic near. And also she has fever. She has vomiting. She has loss of weight, and she said she can eat normal. Fever, it is there, and it is for it come in the evening, and she feel cold also at night. So I sent her for a sputum test in the laboratory.
As we received the form from the patient, we received it and we registered it. We give the patient laboratory number on the form. Then we give a container to the patient, and we talk to the patient in a way that he can go and bring us a good sputum, which will be reliable to what we are doing. So the process is this: advise the patient to go in a place where there is no any person and open the container. Then she breathed in deeply before he or she coughed, and coughed out the sputum and spit in the container and bring us the container back with the specimen. Then we give another labeled container so that the patient will sleep with the container. He or she also can collect another sputum and bring it to us here, and that is early morning sputum. And we also give him again another spot so that he or she can go and produce another sputum. We are just doing 3 sputum specimen.
Once the patient has submitted their sputum, the lab technicians perform tests on the sputum to determine if it is infected with the TB bacteria. The sputum test is the most conclusive test for TB bacteria, and the process of testing takes 2 hours.
When the results are out from the laboratory, they are brought in the TB office by the lab assistants who is on duty, and we select the ones which are positive and the ones which are negative. The ones which are negative, we talk to the patient and we counsel them. We tell them the results, they are out and they do not have the germs of TB. So we are going to give them treatment, strong antibiotics. They take home, they take for 10 days, and if no improvement, they can still come back to us. The sputums which are positive, we call the patients. We explain to them about the sputum. It was positive and the bacteria were seen. And then we talk to them about the health education, how they are going to stay, how they are going to take the medicine, and how long are they going to take the treatment, and also how they are going to be followed up if they are not going to be admitted, and if they are going to be admitted, we admit them in our hospital.
The patients who have TB are also tested for HIV.
HIV is a driving force to TB. As you must know, when the immune system is too low, that is the time you will get all the diseases. TB is among those diseases you can get when you are suffering from HIV.
After the HIV test has been carried out, the patient is then admitted at the hospital ward. Relatives who may have accompanied the sick patients can also be accommodated within the hospital compound.
So the patients who are seriously ill with the positive TB, we admit them in the ward in the hospital for 2 months. We give them every morning medicine until 2 months are over. And those who are not seriously sick, we just give them medicine to take at home, and they are followed by the mobilizers or with a treatment supporter, of which a close relatives comes, and we teach them about the medicine and we encourage them about following the patient's taking of the treatment. Before we take our medicine, we want to remind ourselves about the prevention of TB.
Every morning, the TB officers carry out the DOT program, Directly Observed Treatment. The patients are given further health education on various issues that will lead to their physical well-being.
Every morning before we start giving the medicine, we start with giving health education of hygiene in the morning, to clean the surrounding where they are living, to prevent other bacteria and also to prevent the germs. And we also teach them about nutrition, because also nutrition, to eat high nutritious diet can also make them have heal of TB very quickly.
Langala bayala cake. Rian ilaj warin chanin jala botyo. Ku jarel tinten. Ku jal ka jwai ka chit ka won ki nang te ka chit tu nyo den ka kala pal ke kala. A chabaping. Kwa te ganda kwa chi ping. Kwa nge je nang yok ran kala again palkan la ku palkan la. Mình thì rất là anh anh chỉ có là đúng luôn đi áp lực đúng luôn chỉ là gan kêu tầm mấy cái bên này lui bẩn anh nghe giờ nút của chị Cham nghỉ qua là bà là cái
After this, the TB officers supervise the patients as they take their daily dose of the TB drugs. From the adults to the little children, the TB officers ensure that everyone is taking their medicine. TB treatment takes either 6 or 8 months, and a patient should not miss taking drugs even for 1 day.
Chayu cha kun chanen warno warjera kun warbian anbo ache jot ko ache chat ko an bay jot ko mantinga no an churban jot bay chat badet an bandu kitinet tin aten kayane ayo asa jer cha kun.
After a patient has undergone medication for 2 months, they are placed under the care of a mobilizer or DOT supporter before being released to go home. A DOT supporter is responsible for all the patients within a payam. Each payam has 15 villages.
When we admit the patient who is having TB positive, he has a mobilizer who is usually supposed to follow this patient at home to take the treatment. After 2 months, if the patient is admitted in the hospital, we tell the patient to call for us the mobilizer who is taking care of the village where the patient is coming from. And that mobilizer sees the patient and knows that in his village he has a TB patient. So when we give the return date to this patient, the mobilizer comes and sees the return date of the patient. So when the patient goes home, the patient is followed by the mobilizer.
Within 10 payam, we have about 8 DOT supporters. Omar giving DOT, and we choose the person within that payam to supervise that DOT supporter who are giving DOT in the village.
I'm a dot supporter in this area. When I come at morning, I ask him, could you take the approach? He said that I take the approach, I need to give the drug to him. And I tell him how to take the drug well. And then so I have told him that if you take this drug, you will become better.
Kwa yedek nyang saba kichi madida shedek I londi da runelo babara jargi tek lew.
TB is a stigmatized disease in the community. When people they will see that they are getting their TB treatment in their own community, that is where really we can eradicate TB. Otherwise, stigmatization will continue and then we will have more problems. But I have seen that community-based dots is the best way to avoid stigma in the community.
Some patients also come to the hospital for their follow-up.
That patient comes in the hospital after those 2 months and we check the sputum. We send the patient to the laboratory and is tested this one sputum. And when that sputum is negative, we give the patient medicine to continue for other 2 months at home. After those 2 months are over, then the patient comes back again. We give a return date of a specific date of after 28 days. And then the patient comes, we send the patient back to the laboratory, test the sputum. If it's negative, the patient goes back at home to continue the medicine. Then the patient comes back, that is now at 5 months. And we check the sputum another time, and then we give the medicine now for 6 months. So the total treatment of TB is 6 months, if the patient is a new case. So is he going to agree and stay with us here for 1 month? And then he finishes the treatment.
However, there are some cases where the patient, for one reason or another, will discontinue their drugs. Such a patient is called a defaulter.
Wargan, and you charge by caro. Kujalan to white and get you buncharo. Go yoga liutin. Aren't you yoga liutin? Go and yal ban yali bogbe. Jalan kirwal panto. Go wabdi go jala quedben. Ajal yoga chitok pialman in the young chitcha ben mat. While a team we have been.
There are consequences whereby the patient, after failing to take the medicine, the patient becomes a defaulter. And the patient can continue transmitting the disease in the community, which is very dangerous because he's usually the source of the TB germs. And his work is only to continue transmitting.
The important for us to trace the patient who are default. The reason is, wherever you cannot continue the TB drugs, and then you will come back next time, the reason is MDR, they will cause MDR. Because patient will take TB treatment, another time they will come and take the TB treatment. This drug will cause the drug resistance.
Through health education, the TB program also addresses other factors that lead to the increase in the spread of TB bacteria. Such issues are lack of hygiene and poor nutrition.
To educate the community on how they can improve their living life, because as TB is caused by a bacteria, when people are crowded, that is the time they can get it.
Through health education, mobile clinics and outreaches, the community is becoming more aware of the signs and symptoms of TB and how they can take preventive measures against the disease.
So the preventive measures are that you need to cover your mouth, the one who is coughing, so that you cannot release out the vaseline so that other people will not get them. Secondly, you need also to come to hospital so that you will be screened, and then if we find that you are TB positive, we will admit you, and also you need to complete the whole course of the treatment. Lastly, you need to isolate from the gathering when you are having cough.
The diagnosis and treatment of TB is free of charge, and this has also helped many people access the health services. With access to free medication and health education, the community will have a better and healthy life.
But actually, the work we are doing, we're doing for them because the drug is for the community. Yeah? We save our community. TB is a difficult, is a disease can kill, is a disease can be cured. If you take your TB drugs, you will be healthy. You will do more work. If you never get the TB treatment, you will die because it is you who wasted your time. If you know you are coping more than 2 weeks, you can able to come to where there is a lab facility.
Yen kan ilai tulgan in kan wara pe ka dia kan no kuin kan chaban do yen mre changi ko waran kan pai tulban in kin chaban do yemen chan jal ban pana kum gar yang yen pai blegan de chogen banaruan ka jal bot chok ban a chawan yo len na ke pin den ka nak ban che jal man pai
lawal wal yegen ka ayegen bakaya dik nyang nyak ke chikang lui ba thut ku jal ke dik ba chen ke dik la yang ngi pian de chi du pin ko are de mi ko ju ban man yang ngi na hiang tin wal ka bakaya dik dai man anang real bu twan bi jal yap.
What is very important to know is that TB is curable. It's not an inherited disease, as the people they think in the community. Drugs are there, are free of charge. Everywhere in the health center, you can get treatment without to pay.